How health insurance companies profit by denying your claims. December 2024, a healthcare CEO is shot dead in Manhattan. The shell casings were etched with 3 words: deny, defend, depose. Instead of outrage, the internet responded with memes. Donations for the shooter, over $300,000. What does it tell you when Americans sympathize with a murderer over a healthcare executive? It tells you the system has lost all legitimacy. Today, I'll show you exactly how health insurance companies make money, not by providing care, but by denying it. Follow the money. Section 1. The Denial Machine. 6 companies control over $1 trillion in U.S. healthcare. Combined profits? Over $20 billion a year. The CEO of United Health made $26 million last year. A top neurosurgeon who saves lives? $800,000. The guy who denies your surgery earns 30 times more than the guy who performs it. Now, denial rates. ACA marketplace insurers reject about 20% of all claims. Some insurers, over half. Medicare Advantage, 53 million prior authorization requests last year, 4 million denied. A government audit found 13% of those denials should have been approved. These weren't borderline cases. They were legitimate claims rejected anyway. Here's the math. Deny 1,000 claims. Only 10 people appeal. That's 1%. 4 win. The insurer keeps money from 996 claims. But here's what's insane. When patients do appeal, over 80% are overturned. 80%. If most denials are wrong when challenged, what does that tell you? They're not betting on being right. They're betting on you giving up. The strategy has a name: deny, delay, defend. It originated from McKinsey consultants in the 90s. Now it's industry standard. And 99% of the time, they win that bet. Where does the money go? Cigna spent $7 billion on stock buybacks last year. That could have paid for 200,000 knee replacements. Instead, it inflated stock prices. Section 2. The algorithm. 1.2 seconds. That's how long Cigna's algorithm spends reviewing your claim before rejecting it. The system is called PXDX. Mismatch between procedure and diagnosis? Denied. No human involved. In just 2 months, this system rejected 300,000 claims. Medical directors signed off in batches, 50 denials per minute. Is it humanly possible to review a patient's file in 1.2 seconds? The physician review is a legal fiction, a rubber stamp. United Health has its own AI weapon, NH Predict. If the algorithm says 14 days for a broken hip, coverage ends on day 14, whether you can walk or not. When patients appeal to federal judges, these AI denials are overturned 90% of the time. The lawsuit calls it a fraudulent scheme, but fewer than 1% of patients ever make it that far. The system bets on you dying, giving up, or going bankrupt before you can fight. I denies at scale. Humans appeal one by one. The math always favors the insurer. Section 3. The shell game. The law says insurers must spend 80% of premiums on medical care. Sounds fair, right? Here's how they game it. United Health owns Optum, pharmacies, clinics, data services. The insurance arm pays the services arm inflated prices. On paper, medical spending. In reality, profit moves to a different pocket with no cap. Real example, a CVS pharmacy benefit manager charged $17,000 for a drug. Cost Plus sells the same drug for $72. That spread, booked as medical cost. Actually pure profit. The US spends over $1,000 per person on healthcare administration. Other countries, $200. 5 times more just on paperwork and denial systems. Since 2014, these companies spent over $600 million on federal lobbying. $600 million to protect a $1 trillion market. That's the best return on investment in America, and that's why nothing changes. Section 4. The breaking point. When Brian Thompson was killed, the public reaction shocked everyone. Not grief, dark humor, memes that his claim was denied due to lack of prior authorization. On one side, executives making $26 million a year. On the other, families crowdfunding for cancer treatment because their claims were denied. When the public sides with a killer over a CEO, the social contract has collapsed. And the industry's response? More lobbying, more AI, more denials. Conclusion. Here's the bottom line. Health insurers profit by automating rejection, gaming regulations, owning the whole chain, exhausting anyone who fights back, and buying political protection. They say they prevent fraud, But 90% of AI denials are overturned on appeal. They say they control costs. We spend double with worse outcomes. What can you do? Always appeal. You have a 40 to 80% chance of winning. Demand written explanations, document everything. Contact your state insurance regulator. And most importantly, don't give up. They're betting on your exhaustion. Don't let them win. The business model is simple. Deny enough claims until most people give up. The only way to beat it? Don't give up. Subscribe if you want to understand how money really works in America. And if this video disappears, you'll know why. See you next time.